Speaker. I'll tell you how I came across his name and his products. It was quite serendipitous. It's 12:30 at the Husser residence, and I'm in bed, and of course my bed is full. There's a Townsend newsletter, and there's dental journals, and there's medical journals, and there's a couple motorcycle journals over here, and Motor Trend is over here, and the new turbocharged Corvette. So I'm reading a lot. It's 12:30 at night. I'm reading this letter in the Townsend newsletter about different strains of Borrelia written by Dr. Marks, MD, not Carl, down in Los Angeles. And he said he's had tremendous success with some herbal remedies for the treatment of Lyme's disease. And then in his letter he talks about bipolar disorder, and he said he's never muscle tested a patient that had bipolar disorder, didn't show positive for some type of spirochetal infection in the brain. So right away my eyes lit up. I looked up and I said, okay, more stuff to learn. So I gave Dr. Marks a call, and then at the bottom he talks about, in the letter, it was a place called the Monastery of Herbs. And that kind of whipped my appetite, so I called Mike Phillips, who was the owner of the Monastery of Herbs, and we were on the phone for about 45 minutes the first phone call. A couple days later I got a little test kit, and then a couple days later he got a bunch of orders from me for some of his herbal things. Well, I'd like to present Mike Phillips as our next speaker, and he's the owner of a rather unusual and provocative healing center called the Monastery of Herbs, located in Los Angeles. His company was among the first to explore many of the ideas that are now being put under closer inspection. During the past 31 years, the Monastery of Herbs has specialized in viruses, bacteria, and fungal research. There are handouts, and I think everyone has one, of their products here. And you'll see they're ranging from assorted viruses, parasites, bacteria, and I like to have you look real well at the bacteria. Spiro L, Spirolepto, Spiro P, Spiro T. And you can see there's West Coast limes, East Coast limes, and Spiro X is the unclassified mutation for limes. Over on the other side, there's oncogenes, which fascinates me. Maybe we'll talk a little bit about that today. So, without further ado, Mike Phillips, come on up. I'm going to put this on a pocket somewhere.
Great.
Alrighty.
Okay.
You're all set.
Everybody can hear me? Thank you so much. Thank you, Carol, for inviting me here, and Chris. Let's see. Let me look at some notes here first to get started. What we're going to talk about today is a few things that Monastery of Herbs has discovered over the past 30 years or so about viruses, bacteria, fungus, and parasites. That has been our specialty for that period of time. The owner of the company originally, Cliff Aldridge, about 25 years ago, had a very bad case of hepatitis C. And this is like 25 years ago, where they didn't even know what that was practically. They gave him 10 days to live and said, go home and take care of your paperwork. You know, starvation's not a bad way to die. So I thought, this is interesting, you know, and he had a small herb company dealing with what was called tissue support, and tissue support deals with lung, liver, kidney, spleen type goodies. None of that was working. So he, as the story goes, prayed to God, whoever he, she, or it is, and said, I need you to show me through this specialized meditation process that they were using at the time, and through the muscle testing, to put something together that will heal this hepatitis C. And here's the deal, if I get healed, I'll devote the rest of my life to healing. And that's exactly what happened, is he did get better and then spent the rest of those years looking at people's immune systems and things like that. So Monastery of Herbs is an interesting name for a company. Originally our name was called Herbalife. How many people have heard that name before, Herbalife? That's a pretty famous name. And we originally had the copyright to that name about 30 years ago, and they came and knocked on the door and said, well, we're going to sue you because you're using our name. And Cliff at the time said, oh, well, you know, check the Hall of Records. And we've been there and done that, whatever, but we've got more money and better attorneys, so can you afford to defend yourselves? So it was kind of interesting how, you know, we kind of let go of the name and went with Monastery of Herbs. These things are made in a monastery setting, so we don't run around with like robes or anything like that, but these herbs are made with a vibrational force to them with specific prayers and blessings that are made. We also have no stock on the shelf at all. So when these orders are called in, we have to make them vibrationally from scratch, and we associate the person's name who's ordering the herbs with that particular herb set, so that that person's name is used in the prayers or blessings as these things are going on. We feel that it adds an extra amount of intent and integrity to the product. What Cliff found out is that the simple herbs that people were using and combination herbs that were being done at that time were not strong enough to affect what we call causative agents. You could have a sinus infection, and any herb company is going to have something to give you to clear that up in a day or two or three, as the case may be. But he always was wondering, why was your immune system down in the first place? How do you know it wasn't tuberculosis up in the nasal cavity or Lyme's disease or something else? So that's where he started to develop his concepts dealing with causative agents. And causative agents deal with virus, bacteria, fungus, and parasites. And he kind of felt that really an herb is an herb is an herb, and almost anybody's herbs are going to detox you and cleanse you. I think that's true even with Western medicine. However, it doesn't really explain why your immune system was down in the first place. So then what he did is he decided to put herbs together and add a nutritional base to these herbs. So we manufacture our own tinctures that go with the dry blended herbs. So it comes in a little packet. I'll show you what the packet looks like, and I'll pass it around. This one happens to be for mycoplasma blood infections. We have about 11 of these different formulas for that, and it comes with 2 tinctures and a dry blend. So the reason why I'm holding it up, I'm not necessarily trying to sell something, but I want to talk about the manufacture process and why our stuff works so well the way that it's made. So when we make these liquid tinctures, they come in a bottle around this size, a little bit larger, about 4 cups of liquid. The liquid's either vinegar, rice vinegar, or alcohol. And to that, we add almost 300 different tablets. I'm going to pass this around so you can see what this is. These are different types of amino acids, enzymes, proteins, vitamins, and minerals. They contain aspartates and orotates that will open up the cellular walls so that the vibrational energy of the Chinese and the South American herbs that we use can go to the nucleus of the cell a lot faster in that transportation system. That's why we're having a lot of times the success that we have. It's because of that mineral transportation system that does that and then takes that vibrational energy. Cliff realized that Chinese herbs were wonderful for people, but they weren't necessarily designed for Western lifestyles. Nobody wants to, spend weeks making tinctures and taking all the bad taste and stuff like that, and Americans want to pop pills. So our answer to that was to encapsulate a lot of the Chinese herbs and put them in that particular form. We also felt that American and South American herbs were good also, but in the combinations that were going on, they were not really strong enough to address what we call the causative agents. So many of our formulas have about 10 to 16 herbal combinations together. We're getting a lot of complaints from people who find our product that their complaints is that other companies do not kick butt, so to speak. The formulations are not strong enough, which brings us to things that deal with homeopathy and herbs together. And I think it's a nice marriage together. I find that when you have people that have been sick a long time and chronically ill for a long time, oftentimes I'm not getting good results with some homeopathy things, and their immune systems need more of a jump start. So these are things like mega doses. When you take 20 drops of the liquid extract, that's equal to swallowing like maybe 30 or 40 supplements at the same time in a liquid form, which it's easier to do that way. So you're taking like maybe 40 to 60 supplements a day. Let's see, what can we say here? Let's take a look at our first handout. And the first one, I'm going to have you ask questions during this presentation. Instead of doing it at the end, you can just raise your hand and then I'll point to you and you can ask a question at that point. Let's take a look at this first one. It says Monastery of Herbs up in the right-hand column, up at the top. It says, note, this is a causative agent list sold as sets for $23 to $29 a set. The set includes 1 bottle of dry encapsulated herbs and 1 to 3 liquid tinctures. Taken as a set, 4 caps a day, one at a time, with the tinctures taken first. Let's start with assorted viruses here. These assorted viruses are, just like they say, assorted viruses that we've seen come up in testing. We have people from around the world that do this type of testing, so we can kind of see where these outbreaks are happening in the country, what are the most common and prevalent in society today. So the Epstein-Barr virus is the first one that's there. And infectious mononucleosis is another. The Epstein-Barr oftentimes is very good for people who have ADD. We find that when we give this to kids, that straightens them out like really quick, right away. These programs are done on an 18-day basis, by the way, also. So you're taking 4 pills a day and 1 squirt of each tincture, and then you're done for the entire time. So you don't have to keep retaking it throughout the day. It's for an 18-day period. The different types of reaction that you can have when you take these herbs, there are things that happen about 70% of the time. People just start to feel better. Then there's about 30% of the time where you'll go through lots of diarrhea, headache, nausea. It's got to chase it out through the system somewhere. It's going to come out through your rectum, through the lungs, through rashes, through headache, those types of things. When those things happen, of course, it shows that the herbs are doing what they're supposed to do. Some people don't like to have the inconvenience of having the diarrhea, so we want to make sure that this person is not going to get dehydrated. So we have a handout that you get. You can borrow ours or make your own. And that handout talks about diarrhea a little bit, and at the end of the second day, if you still have all liquid diarrhea with no dime-sized pieces floating in it, then you stop taking the product, everything that we've given you, wait till your body adjusts to the energy that you've been putting in it, and when you retake the product again, the diarrhea hardly ever comes back, if at all. It's very interesting, that particular effect like that. Questions?
I'm sorry, my dog is...
Oh, that's okay. Friendly there. Let's talk about the infectious mononucleosis. We call that glandular fever. This is the kissing disease. It can give you an irregular fever, lymph nodes that are swollen in the sore throat, headache. The most common age is about 15 to 40. The cytomegalovirus, we actually have some stool samples that have been done on cytomegalovirus. It's supposed to be pretty difficult to get out of the body, and it showed that it was cleared in the 18-day period also. It's a member of the herpes family, the cytomegalovirus. Oftentimes there's no symptoms other than kind of like a mild flu, but you don't really know. After listening to Chris's stuff today, it seems like I get that feeling that we're out with the X-Files, you know, the truth is out there, and I think you're hearing a lot of stuff that is important and true. We're going to expand on it further today with a lot of these things. This is research that was done by Dr. Marks and Cliff and some for myself over the last 30-year period. You're not going to find a lot of the stuff in the textbooks that's like this. A lot of people like to use Flagyl oftentimes, but then again, if you look in the physician's reference, it says that you should only use it maybe once or twice in a lifetime because it causes a lot of liver and kidney damage later on. So I kind of like the herbs because of things like that. I think that there's nothing wrong with any type of Western medicine, and I'm the first one to take it myself when I need it. But if I have the time and the inclination, I'd rather do it herbally first and then save the Western medicine for the big guns when you really need it. Because if you're always using the strongest stuff that you can get, and you're going to go in and That's true too. You got to figure out a better way of doing it so that you can, get across to the subconscious mind a little bit with that. Let's go on. Hepatitis C. Gone practically to zero on a lot of his cases. Now, whether it's completely cured or just put to sleep on them, semi-permanent level, we'll see. But we've had wonderful luck with the hepatitis C. Hepatitis A and B, we don't think that you can get hepatitis B just from blood and needles. We think it actually goes from person to person now. These things mutate a lot and they change very, very quickly. And our findings are that it can go person to person. We don't see a whole lot of it, but probably a lot of hepatitis A and a lot of hepatitis C is more common. The HEPAT V as in Victor formulas down at the bottom are all mutations of earlier versions of hepatitis, and they're still out there. I'd probably say the most common one would be HEPAT V number 2 is the most common out of all of those. That brings up a question some people think about is why there's so many different formulas in here. And that's because the Monastery of Herbs believes that you can't really go in with a magic bullet formula and make one formula that's going to kill off all bacteria, let's say. I mean, why would you want to anyway? Because most of it's good for you. So we've tried to target specific causative agents for particular things in the body, and that's why there's a separate set for each goodie. And like I said, the nutritional support is so important to something like that, because most herbs can do things very well for the body, but they're not really going to help you get your immune system back in order. And that's why these are so important. Let's give you these little bags to look around. In this bag right here is about, I'd say, a half a pound of Chinese and South American herbs that are powdered. And this goes in the little tiny half-ounce bottle of the liquid extract. So it's about that much herb and about that much of the amino acids, enzymes, proteins, and vitamins. All right, let's go down to herpes viruses. And there's many, many different types of herpes viruses here. Excuse us while we fix this little bit for so. Okay. HPVS number 1, the herpes simplex number 1, from our research is probably a lot more damaging than people have ever seen it to be. It really brings your immune system down real fast. I mean, just think about it. If you can't even fight off a little cold sore, where's your immune system to fight that off? I mean, if that's all it takes to get a little stress and then have something come out like that, you can imagine that it's probably doing a lot of things to the body. We think that there are people who can have a magic number of viruses, bacteria, and parasites in their body and just keep them as with no symptoms at all. Everybody has a certain number. It could be 2, it could be 4, something like that. When you have symptoms, it means that, for us in our research, that your symptoms are actually coming from the first one that you picked up, the virus, the bacteria, the fungus, or the parasite. You're getting your symptoms from the very first one. So if your magic number is 4 and you get a 5th infection, that infection is actually coming, those symptoms are coming from the first one that you picked up oftentimes. Genital herpes, we have about 5 herbal combinations that are rather spectacular. The rest are just like, they're good herbal combinations and they work fairly well, but there's about 5 of them that are really good. And the genital herpes one is really spectacular. We've never had a failure on genital herpes, and it usually can go away within, we've seen about 4 or 5 days. Yes?
When you're saying going away, do you mean symptomatically going away or eliminating the herpes simplex 2 virus?
I can't tell whether it's gone completely or not. I mean, all the symptoms are gone, and people are real happy with that.
Do they get recurrence?
Not as much, no. No, they do get recurrence every now and then. This is one of the blends where it gets worse before it gets better. You can take it even if you don't have an outbreak. It may give you an outbreak right away, but it usually dries up faster and goes away, real quick also, and then it doesn't come back as often. So we've had really good luck with that particular type of herpes virus. The number 4, the HPVS number 4, the chicken pox, this one oftentimes gets clogged arteries and causes a lot of problems with calcium and things like that. So people that have a lot of arthritic complaints and things like that have taken HPVS number 4. We've had people that come in on crutches because they can hardly walk and taken this formula, and within like about 7 or 8 days they're like practically dancing in the street. Not everybody, but you know, we've had some chronic people with that. HPVS number 5 is a mutation. There's HPVS number 6, which is chronic fatigue. Oftentimes we find that lymphogranulovenereum is a disease up in the lymph glands that oftentimes is a finding with chronic fatigue at the same time. HPVX number 2 is a mutation, and the herpes zoster shingles, that's another one that we've had really good luck with. We've been able to stop shingles, personally, that I've seen within 2 hours to 2 days on that particular formula. And that's with post-shingle people also. Now, it doesn't work. You can expect, I'm talking about, you can expect a miracle in one bottle if that's the only thing that you've got. The problem is, it's like a can of worms. Once you start to attack one particular virus type of thing, your immune system responds. You're taking like up to, 250 to 300 tablets of stuff. It gets perky and says, okay, well, I can take care of this one now. And then you start getting symptoms and you start feeling bad again. And people think that they have a reinfection of the same thing. It may not be. It could be, 5 or 6 different things. When we test people, either from a stool sample or a blood sample or from the muscle test, people are coming up with sometimes dozens of different things. You have to have a priority of what the body wants to work on first. I like all the theoretical things that we say, but again, the one thing I like about muscle testing is that it can give you a priority of what the body wants to work on, where sometimes machines can't. I think that blood tests and other type of testing is accurate to its own point. I think that sometimes because these diseases you have in your magic number, like I talked about earlier, I think that the mechanical testing sometimes don't pick up low-grade infections. If you have an infection that's below 30 percentile in the body, I think the machines are going to have a harder time picking it up. And that's what I like about the muscle testing part to it. Yes?
Maybe I'm just not understanding this. When you're saying you're using the muscle testing, are these vials as well that you can use to test to find out what these are? Or are you just going symptomatically that someone has herpes?
I think you could do 3 different ways of doing it. You can do it with vials, and we do have some test kits available. You can do it, we've always done it over the phone because you can't reach everybody. You can't help everybody, obviously, right? So we do muscle testing over the phone, or you do it off the sheet of paper. Some people like to have the actual product on it themselves. Here's an interesting fact too, is that we get people who are just sensitive to life. We're going to talk about this and these mental, spiritual miasms and viruses that people carry, and we have blends for that. When a person is allergic to, let's say, alcohol, because we have alcohol in the tinctures in one of the bottles, and the other one is vinegar or rice vinegar, like I said, we find that people, when they take the tincture, are not allergic to it after all. Because when you have amino acids, enzymes, proteins, vitamins, and minerals, and then mixed with like 15 or 16 different Chinese or South American herbs, alcohol ain't going to act like alcohol anymore in the body. Let's say a person's allergic to golden seal. We get this all the time. Oh, I'm allergic to golden seal, I can't have it. Well, how do you know that when you mixed golden seal in there that it's going to act like golden seal when it's with 16 other herbs? There is no test that I know of that you can do that can prove that golden seal acts just like golden seal when it's mixed with 16 other things. So how do you convince that client that when they get sick with diarrhea or headache or nausea or something like that, how do you convince that client that this is just the natural recursion of the herbs rather than in their head they're thinking the golden seal is making them sick? It's an interesting little dilemma. I haven't found like a really good answer to it yet, but if the client thinks they're going to get sick on something like that, it's hard to convince them otherwise sometimes. It's always interesting to see different herb companies come up with a lot of interesting herbal variations of things. We do a lot of vibrational testing, which means that we feel that we have a nice way of putting things together in a blend. If someone were to say, oh, Michael, you know, why is peppermint in your blend? You know, that's supposed to be good for your stomach and calming for your stomach. It may not even be in there for that. How do you know that peppermint does anything for your stomach after it's mixed in that chemical soup of 16 different things? You see? We're not interested in why peppermint is in it individually. What we want to know is what is the total, you see, the total vibrational content of that mixture together on a scale of 1 to 10. How high is it? How effective is it against hepatitis C? That's the only thing we're concerned with. We could get slightly controversial with this because, you know, how do we know what to put together? I look at other companies, the labels from companies, and if you know anything about herbs, even just the slightest little bit, you can usually figure out what they're trying to do or why a certain herb is in there. But then my argument is that how can you say that that's going to do that when it's mixed with those other herbs? It doesn't, you know, peppermint cannot act like peppermint when it's got 15 other herbs in it. Not very many people have that many in their herbal combinations, but isn't that interesting? So, you know, how do you know that when you mix A and B together, that A doesn't cancel out B energetically? The part that will either turn you on completely or turn you off completely is how we do all of this stuff, which I will share some of it with you. Again, with the name Monastery of Herbs, there's going to be, from my ex-Catholic background, a lot of things going on with that kind of stuff. We take it pretty seriously. None of these herbs were put together on a traditional knowledge basis. We all know that peppermint does great stuff for your stomach. It's been used for the last 5,000 years like that. But that's not why we would put it in a particular blend. All of the things that we have put together over this 30-year period have come from spiritual sources, basically being told that this would be a good thing to put together. So the people look at our label and go, oh my God, why is this in there? Or why, I've never heard of that being in there for that particular type of thing. They're always puzzled, pleasantly so, of why the labels look the way they do. And my reaction to that when I first heard about it was like, oh, okay, God told you to put that in there. Even though I'm spiritual and have a religious background, I've studied for the priesthood twice in my lifetime. So I like all this stuff, but it was a big, far stretch for me to think that, you know, God was the one that was telling how to put these things in there together. But the honest to God truth is that's the way they were all put together, very differently. So they're put together by a vibrational force with that in mind. With a 30-year experience of doing all of this stuff, I couldn't argue. I mean, we have doctors and practitioners throughout the world that use this stuff and, you know, really love it a lot. So who am I to come along and all of a sudden say that this can't be true? So I like the reputation of the company, you know, for the last 30 years of dealing with these things. So I'm off the track here. Let's go on a little bit more. Where did we leave off at? We were on the herpes viruses, correct? Let's go to the wart viruses. The human papillomavirus is a very nasty one for the immune system. We're not talking about big O, like warts on a witch nose that you can see. These things can be so tiny they can be as small as a grain of sand. They can be anywhere in the body. WHPV is a real common one. The immune viruses, HV, these are all HIV viruses. We do not have a good handle on HIV particularly. We feel that we can slow it down a lot. I've had clients that had Kaposi sarcoma with purple lesions on their back that were 11 inches long and about an inch wide down the spinal column. And I've seen people with just a little purple dot the size of your little fingernail die within 6 months. Yet this person had these purple marks on their back for 10 years. So we can slow things down. We don't have a real good fix for it. The HVIMN is the immune virus, the lymphatic virus, intestinal virus, the DNA virus, and the miscellaneous, HVMIS. HV stands for HIV. We took the I out of it because too many people freaked out, you know, when they saw HIV on the bottle. So we kind of just named it HV instead as a little subtlety there. Let's go on to some parasites. Everybody has a lot of stuff on parasites. We're not going to do every single thing here. When you take one of the formulas and you do it for muscle testing from a parasite formula, it can usually correct it within 1 hour to 1 day. That doesn't mean that you don't take the formula for the full 18 days. Everything on this page, all these different formulations, the dosage is always the same. It's 4 pills and 1 squirt of each tincture, and it's all to be taken simultaneously at the same time. You can take more than 1 set at a time also on some of these things. The PSAL is the large roundworm. PSBC is Ballantinium coli, and there's an alternate blend 1 and an alternate blend number 2. These are dry blends that are different. They're slightly different energetically, and either your muscle testing machine or the regular muscle test will tell you which one is the best one to use. Let's go on here. Question? Blastocystis hominis, yeah, that is PSBCH. That isn't, it isn't as common as we would think, but it is out there. We haven't found a lot of people actually really using that particular blend. It may be just maybe in your particular area that it's out there.
Take it for 18 days too, all of them?
Yeah, all of these are an 18-day program, which brings up another good question too about how do you get all this stuff done in 18 days? I mean, there's other people that say you need to get the egg stage and the larval stage, and you have to be on this stuff for 3 or 4 months at a time. We found out that people don't want to be taking this stuff forever. They don't want to be on it for a long time. And the reason why we can get the egg and larval stage with a lot of this is because of the amino acids, the enzymes, proteins, all that stuff in the tinctures boost your immune system so that it turns on real fast and it can get all these other things and take care of it itself. And that's why we can do it in an 18-day period. It's rare that you have to have a blend more than once. Every now and then you have to have a second blend, but not always. Other questions on that? The chitomastic mesonellae, the PSCMM, that doesn't come up very often, but it is vague digestive disorders. Let me just skip a few things and go on to the ones that are most interesting. Let's talk about PSEV. That is the pinworm goodie. The number 1 symptom for pinworms that we have seen is when people go like this and they touch their nose. If they're always playing with their lip or their nose up in this area, it's the number 1 sign for pinworms. Pinworms are real tough to get rid of, even this formula. It's like if you don't follow it exactly, it doesn't help it. Excuse me? That's PSEV, Edward Victor. It says here that they're so light that they float through the air, these little eggs that the female lays. She kind of crawls out the rectum and lays 5,000 to 6,000 eggs a night. And then when you fluff your pillows or you're fixing your sheets on your bed, it floats on the carpet and the drapes and stuff like that. And everybody in the family gets infected at the same time. We talked about how you get these things in your body. It's not just that you're always getting from the outside attack. A lot of the times we feel that these things are in your body all the time and everybody has it. And it just stays dormant, and then when you get under stress or different things from dental traumas and things like that, then these things kick up and start to get activated in your body. What about the magazines? I didn't finish that little story about the magazines in the waiting room and whatever. How many people have seen yellow pages on books? On magazines and things like that. That is actually a fungus that's making the pages turn yellow. You have the fungus all the time in your hands and the oil and humidity in your hands, and when you touch those books, it gets transferred to the pages, and when you close the book, it's dark, and it grows, and that's what makes the pages yellow. So having a lot of these things in the office like that are very good ways of transferring a lot of these parasites and viruses and bacteria. It's something to think about. Your front door handle to the restaurant or to the office is another major part where everybody is touching it. You don't know where they've been or what they've been doing. That's the first thing the person does, is touch that door handle. It is interesting. Okay, it says here also with the PSEV that you need to wash your sheets every other day for about a week, and you need to change your clothes and underwear every single day for at least 2 weeks. I've had it before. It's not fun, and when I didn't do it correct, it came back again. So you have to be real careful, and you have to treat the entire family with that kind of stuff. Interesting about the word treat also. I kind of asked Carol earlier today, I said, you know, I'm not clear on medical doctors versus dentists, and what can you say and what can't you say? And when you're getting into a realm of medicine like this, it can be kind of interesting to see what kind of reactions you get from the medical establishment. My little favorite thing to say is I never say a person has this, that, or the other. What I say is that this person needs this particular blend called PSEV. That's why we have these strange code names on all the bottles, because we don't want to get in trouble with the FDA by making claims on the label. So I don't know what your medical responsibilities are, but I think it might be safer when you're talking about causative agents such as viruses and bacteria and fungus to maybe just suggest, I mean, me not being a doctor, it's illegal for me to even suggest that a person has an infection. That is totally illegal for me. So I don't say the person has this, I say this is what they need. And I think most things will support you in that by saying something like that. Filaria worm also affects the lymphatic system. That's another one that's an important one. It comes up a lot. It also causes a lot of staph and strep infections. And since we're talking about staph and strep, some of the dentists that use our product, the number one thing they like, there's two of them that they talk about. One is the staph infection. And what they do if they're going to do a root canal is they start the patient on the medication for Monastery of Herbs about 5 days prior to that root canal, so that they're setting up within the system systemically to fight infection from the very beginning 5 days prior. And then they do their work that they need to do, and they continue for the 18 days on the program. And they haven't had to do a lot of antibiotics and things like that, whatever, to fight off some of the infections. I think it's kind of a smart idea. I wasn't my idea to actually, I didn't suggest that, some dentist told me about it. So I learned a good one on that one. It seems to work fairly well. No, that's the staph and strep infection. BT stands for bacteria, boy Tom. We'll get to that one in a couple of minutes. Yes?
Have you used any of these prophylactically to circumvent the use of antibiotics for something like microbial prolapse, dental procedure, or any knowledge on that?
Not specifically for that, no. But, you know, we're an herbal manufacturer, so if you feel like you have something that would be good or another product that's good, but you know that it needs to have like vitamin B1 in it or some other thing, that company is not going to change their formula just for you. But that's where we come in, because we're so small. We can do that. We can duplicate a lot of different formulas, and then you can name it whatever you want and put whatever you want in it. We have a very small minimum order for that, so the minimum order for something like that would be like 10 bottles or something like that.
We can call it penicillin, right?
Say that again?
We can call it penicillin, get by legally and give anything.
Yeah. Our natural antibiotic is echinacea and golden seal, and there's one missing ingredient. Everybody on the planet has got echinacea and golden seal. I'm sick of hearing about it, you know. But we feel that energetically it doesn't work right when you put them together. It works okay, but it doesn't work as strong as what we would like, because these things are mutating and getting stronger. So if you put one log in a fireplace and you use just one herb, it doesn't really work right. It can, but it's not really potent enough. If you put 2 logs on the fireplace, it burns a little better, but not quite. It's when you have that sacred triangle or the Holy Trinity or whatever you want to call it, 3 or more usually work better together. So the missing ingredient in our natural antibiotic is the garlic. So it's echinacea, golden seal, and garlic together. We have people put that in their medicine chest just as a precaution, you know, as a first aid measure, basically. Another finding that was good, I'm off the track here, but this is okay, we'll talk about this for a moment, is that I have 100% accuracy on something that I want to share with everybody here, because maybe you can teach me what this means, because I don't know what it means. I first heard this word, I don't even know if I'm pronouncing it right, but it's called, Carol, you told me about it, where is she? It's bruxism, am I saying that right? What is that word? Is that when you grind your teeth, right? Okay, every time in the past 8 years that we've had anybody test, and it's not just me, so I know it's not coming from me, it's the other doctors that do this too. Anytime the atypical tuberculosis comes up in a test, 100% accuracy is that person has something weird about TMJ or grinding their teeth or something like that or whatever. I think just psychologically it's grinding away at them, and that's why they're doing it also. So tuberculosis 90% of the time will not be found in the lungs. And you won't find that in the medical textbooks either. Tuberculosis can go anywhere in the body, according to Dr. Marks and some of our research. So play with that, and if you have any ideas on it or whatever, maybe you could call me up someday and tell me more about those findings. Let's go on to the next one, Giardia lambia there. It's a protozoa that lives in the intestine and gallbladder. It damages the intestinal walls. It's very common. Every river and lake in the United States has got Giardia in it. I had a couple of veterinarians call me within this past week and said every time it rains, all of their animals at the pound and stuff like that end up with diarrhea and Giardia because they're drinking the water from outside and stuff like that, and it's just full of it. So they have to give the animals treatments for Giardia. When we treat animals, we give them only the liquid tinctures. You don't have to do the tri-blend with them. Let's go on and see some more here. The excuse me?
Giardia. You start the treatment at the time you know that the animal has Giardia, or do you know they've had it, so you go ahead and treat them empirically?
I'm not certain what type of tests that they were running to find out for sure that they had it, but diarrhea is a big symptom of it, basically. So I don't know what kind of tests they did to show that each time these animals were picking it up. But it is in the water supply, and it's fairly common. It also makes people hypoglycemic also with Giardia. Let's go on to hookworm here. Hookworms drink a lot of blood in your body. It gives malnutrition and anemia. There's a thing called ground itch. When you work in the garden and sometimes you work with the soil with your hands, have you ever noticed that your hands kind of itch after working with the soil because you picked up a lot of stuff? And ground itch is one that is a good indication that hookworm has been going on. It also makes you cough up a lot. It coughs up through the circulatory system, and you swallow it back down. It goes to your intestines again. It's a little cycle. The female lays about like 30,000 eggs per day. It gives you ulcer-like pain a lot of times too, and people will take Tagamet or some other type of thing to fix their stomach, but it doesn't really address what the real cause or problem is. Isoporia belli is an internal sporozoan. It kind of makes your insides look like bombed out Berlin. It really makes it little kind of black-white pepper marks all through your lower system. The lung fluke causes jaundice a lot of times. There's a Dr. Abram Burr, I don't know if you've heard him before, in Arizona somewhere, and he says that the lung fluke is probably one of the #1 causes of cancer in the lungs, and he finds that a lot. Let's go to toxoplasmosis, which is PSTG. You get that from dog and cat poop, basically. And I have 2 cats. And you have to take it about twice a year just as a preventative. If you don't have a cat or a dog and a neighbor does, and it dries, the fecus dries to a microfine powder, and they use leaf blowers or the wind kicks up or something like that, then that can spread it, and it's the #1 cause of headache and dizziness that we have found in the United States today. Yes? What if somebody is pregnant? Dr. Marks says that there isn't anything from us that a pregnant woman can't use. In fact, it's probably better that she takes all of this stuff now during the pregnancy so she doesn't pass it on to the baby. Question?
Well, you said this is good for babesia too, right? This one?
Yes, this is the one that's good for babesia also. We've had people with malaria that have taken this particular formula, and some of them have like a crossover thing. You can't say that one formula is only good for this and the other formula is only good for that. They do have a slight carryover effect. So babesia and the toxoplasmosis is one that helps a lot. When a person comes in with head issues, that means like dizziness, headache, blurred vision, there's a couple of things that I automatically think right away. I'm going to think toxoplasmosis, or I'm going to think Cryptococcus neoformans, which is a fungal infection that goes to the brain. Toxoplasmosis is a brain parasite. It loves brain tissue. One night, a woman came to me, and I did a muscle test, and it came up the toxoplasmosis. And I said, well, have you ever had any ringing in the ear? Because that comes up a lot with the toxoplasmosis and also the Cryptococcus neoformans. And she said, it's funny that you mentioned that, because on the way over here tonight, I heard this sound. There's something wrong with my car engine. I pulled over to the side of the road, and I shut the engine off, and I realized it was the sound that was in my ear. And here the muscle tests are just showing it like that very night, and so she was really surprised. So ringing in the ear can oftentimes be addressed and fixed pretty well with either one of these two formulas. We've seen it change it in about 2 days. It takes about 2 days for something like that to happen. Say again, raise your hand so I can see.
Which
Oh, yeah.
two formulas,
Toxoplasmosis and Cryptococcus neoformans. That's YF, like yes, Frank, and CN, Charles, Nancy. Those are the two that come up the most often with that. It says here that it can be mistaken for flu, toxoplasmosis, fever, headache, liver, brain, heart, eyes are at risk. It's also associated with hearing loss. Now I have this set of notes that I'm playing with today. If anybody wants a set of these notes, it's like $8, and you can just call Monastery Verbs and we'll send it out to you. This way you don't have to be writing madly everything I say here. Let's go on to Trichomonas, PSTV. That's another one that men and women get. It's very common, sexually transmitted. It's a protozoan that lives in the vagina and urinary tracts of females, and in the prostate and seminal vesicles and urinary tracts of males. It's frequent pain on urination sometimes, possible discharges. Older women get misdiagnosed with this because they may not be thinking about having a lot of sex at that particular stage of life. But we found out that the infection point for people who have this particular parasite is they're getting it from the bicycle seats at the gymnasiums. So, I know. It's contaminated clothing or the bicycle seats at gymnasiums. Yes? But it only takes once, unfortunately. The tapeworm formula is the only formula that we have that's a causative agent that does not have the tinctures with it. Tapeworms are so easy to fix that we just don't have to give any nutritional support for that particular one. Let's
Can you give the tapeworm formula to dogs?
Can you give the tapeworm formula for dogs? I think you can, but trying to get them to swallow the pill, I'm not certain. They will take the tincture. Animals take the tincture as well, but you kind of just stick it under their lip, and then they won't talk to you for the rest of the day. Let's go on to some bacterias now. I would say that when people are testing, this is throughout the entire United States, the number one thing that comes up most often with people is going to be bacteria. Yes, in the back.
It's been our experience that lupus is actually leishmaniasis. We had 6 cases, we had 100% results.
Say again?
Interesting.
Say
You said
again?
that lupus is actually leishmaniasis?
Leishmaniasis,
Mm-hmm. We have a formula used for that also.
one of the 15 master diseases.
Can you speak up just a little bit more?
One of the 15 master diseases, very hard to diagnose.
Yes. Yeah, it is very hard to diagnose. That is true. When we use a testing, we actually use hand mudras that are held over the chakras of the body. and that's specifically associated with our product, and we feel it gives a little bit better accuracy. Although any muscle test or any machine will help diagnose correctly, our particular brand of doing that is with the hand movers held over the chakras of the body. Let's talk about chlamydia for a moment. It's the #1 sexually transmitted disease. There's major outbreaks everywhere of this. Pink eye is also considered chlamydia, and it's spread by the hands, basically. Let's go on to bactoenteric. That's for H. pyloric. It's found in water and soil and dairy products. It's also a causative agent in tuberculosis. So you find oftentimes the H. pylori bacteria and tuberculosis together. Let's go to Mycobacter T as in Tom. That is the regular tuberculosis. It also causes high blood pressure, arthritis, and chronic fatigue. We have 2 doctors in Tennessee that are medical doctors using this particular formula, and they're having wonderful success with acne, skin acne issues with this particular formula. It clears it up real well. And it Mycobacter T as in Tom, and that's the tuberculosis formula. And again, your intestines and the lung are connected in Chinese medicine, so when you're clearing this thing out, it oftentimes clears up your skin. Your skin is considered secretly the 3rd lung to begin with, because it breathes also. It also says here that the source point of contamination for tuberculosis that we have found is cattle meat, dairy products. Pasteurization does not kill this type of bacteria. Another source of contamination is when they use cattle manure when growing vegetables. So you'll find a lot of vegetarians have this. It's a very common finding, believe it or not. The atypical tuberculosis we talked about already with neck, teeth, and jaw pain. We're not really certain why that is, but it is there. The BT-NGX is gonorrhea. Anytime that you have a lot of rectal gas, that is usually the #1 thing that comes up in the testing. If you have a lot of rectal gas, it's some type of low-grade infection from this gonorrhea formula. I was in Bogota, Colombia 2 years ago, and a guy called me from Bogota and said that he had chronic fatigue and fibromyalgia, all that kind of stuff. And I tested him, and he came up for Lyme's disease. And I don't even know if they have friggin' Lyme's disease in Bogota, Colombia. You know, they probably don't. But this was the blend that said it was going to help. This guy had been on disability for 4 years. He could walk from the bed to the bathroom and then lay down for 8 hours. That's his entire life. So I sent the little bottle down there, whatever. And then about 10, 12 days later, he's climbing 6 flights of stairs. So that's how I got invited down to Bogota, Colombia to introduce some of the stuff down there. When I was there, they had a big outbreak of gonorrhea. And they said in the medical journals down there that, remember that old wives' tale about, oh, I got it from the toilet seat? Well, actually, that's really true. For years and years, they said that was a lie, you couldn't get it from that. And they said that the source point for contamination was the handrails on city bus systems. And that's the new strain of gonorrhea that's out there now that's a lot stronger than the other goodies. So there's some information on the gonorrhea one. Let's go to ornithosis, BT ornithosis, orni. This is called parrot fever. Down in Los Angeles is where there's Pasadena, Temple City, where there's a large parrot or bird population. That bird fecus dries up to a microfine powder again. Chicken farms, turkey farms within a 50-mile radius will give you the ornithosis, which is kind of almost like a little pneumonia type of infection in the lungs. We're actually breathing the air, even here in the Bay Area, from the desert in Africa. Because of the jet stream, we're actually breathing all of that stuff from way over there. So when I want to hear about, you can't get San Fernando Valley fever in San Francisco. You can, because stuff comes all a long ways. Let's go to Bacto-PPLO, that's pleural pneumonia-like, and Bacto-Proto when your system's been wiped out by antibiotics. It's a cause of deep-seated infections to the ears, mastoid sinuses, peritoneal cavities. It affects the urinary tract. This is Bacto-Proto. So if you've used a lot of antibiotics, sometimes if there's a stubborn infection and you can't get it any other way, it helps to have the Bacto-Proto there. Salmonella and Salmonella comes up pretty much. It affects the bile of the body a lot. Bacillus serrato is a pulmonary infection. You get it by breathing the air in tight spaces like airplanes, hospitals. You can pick it up in the ventilation system of hospitals a lot of times. That is Bacillus serrato. Staphylococcus, that's the one that gives you pimples, boils, carbuncles, and cysts. It can be found in the cerebral spinal fluid. A lot of skin conditions are helped in that particular formula. That's the one I told you about that the dentists were using 5 days prior to the root canal stuff. Bacto VC, viral cholera. That's an interesting one. That is very, very extremely common. Now, you're not going to find the CDC talking about it necessarily, but we believe that the Bacto VC, the viral cholera, is actually a mutated staph infection. That's the superbug one. So if you have a staph infection that's really stubborn, you can't get rid of it, then oftentimes you can use the Bacto VC, Victor Charles, for that. I have a neat little story about that one too, is because when I took over the company, was not a big believer in muscle test. Actually, I was teaching it, and I still didn't believe it. And I had a friend of mine whose elevator doesn't go to the top floor. He's kind of a little retarded, sort of, I guess, you know, and he was in the class, and I had a visitor to Monastery of Herbs and from another herb company, and unfortunately, sometimes it kind of gets into like my dog's better than your dog type of thing and whatever. And he didn't like the kind of stuff that we were doing with the prayers and blessings. He was a fundamentalist and just didn't like all that Catholic stuff, you know. Well, anyway, so John picks up this viral cholera in this man that was here from this other herb company, and I was so embarrassed. I thought, oh my God, here's John, he's done it again. And nobody gets viral cholera in Southern California. This is when I first took over the company. I wasn't sure what that particular was or how often it had come up at that time. And so I came up to the guy and I said, you never had cholera, have you? And he says, cholera? Cholera? What do you mean cholera? What are you talking about, cholera? I said, just calm down and answer the question, yes or no. Have you ever had cholera? And he goes, oh, well, I was in India 2 years ago and I almost died of it. But my herbs fixed it. So, you know, here it is, you know, John, who doesn't even have a full deck, is picking up this viral cholera in that kind of accuracy, had never done a test before in his life. It was the first muscle test he had ever done. You know, and I get this slap in the face, okay, from God saying, you know, okay, Michael, when are you going to get it? Here you are teaching it and telling these people to believe in it, and even you don't believe in it. So it's stuff like that that makes you look at it a different way. So I like to be skeptical on a lot of these things until events prove otherwise. And a lot of these formulas, it's not me that's saying that it's working, it's all the other people who are using these things that says that it works. So I have to be convinced on a daily basis sometimes, because as we make it, I don't get to talk to people like Chris and all these other people that are out there that are using it and saying, wow, this is good, or that works really well, whatever. Because it's usually the secretaries of the doctors that are ordering the things. And, you know, sometimes through the grapevine we hear these stories. Let's go on to Spiro L, Spiro P, and Spiro X. The Spiro L is the East Coast Lyme's disease, and the Spiro P is the West Coast Lyme's disease. And they have gone to opposite coasts. They've mutated a couple of times. There's a new one out there now. We don't have a formula for it yet. We're still under research and development. We've been in the Townsend letter a couple of times for this as having a pretty good fix for Lyme's. I mean, when people have done Venus flytrap and all these other things and whatever, and they finally do this one, it seems to have a really good effect on people. People notice it right away. Spiro T is syphilis. It can affect bipolar issues like we talked about, manic depressive disorders. It affects the heart, blood vessels, and the spinal discs. Spiro T comes up pretty common with people. Sometimes this is really more like a myism than it is. Everybody familiar with myisms? These things can run in the family. These viruses sometimes have been in the family for generations, and then they come up every so often for people. So it may not mean that you actually have syphilis. No one wants to think that, but, you know. These things run genetically. Spirolepto, if this bacteria ever shows up in a muscle test, it's one of the most important because they all have a large die-off of bacteria, so people can expect night sweats, which you normally don't get with the product. You get it by, if you were scratched out in the forest by the urination or defecation of animals that are out there, and you're scratched by that vegetation, or you eat wild berries or things like that. That's how you usually get it. You can also get spirolepto from insect bites, we're finding out. You can suspect spirolepto in all cases of mental disorder. Every single person, Dr. Marks is a medical psychiatrist, and many of the people he sees, he always complains that he can't keep patients long enough, because when you do the right type of nutritional support for people, it changes the chemical balances in the body, and they respond a lot quicker. Let's go on to Mycoplasma bacterias. We probably, how many do we have on that list? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We got about 9 or 10 are on that list. These were all done in different stages. They're all still out there. The Mycoplasma I as an ice is for old injuries, people that have had traumatic injuries to the body and it hasn't healed, or they haven't finally let go of it. That one happens to work very, very well. The Gulf War Syndrome incognito, Mycop incognito, is another one we've had some pretty good success with. These are all mutations or variations of these blood infections. The symptoms are like a flu that doesn't go away, and then it produces symptoms like chronic fatigue. So which is it? Is it chronic fatigue or the mycoplasma? It's probably both, if you ask me. Mycoplasmas interfere with the metabolism of cells. There is a possible cancer connection, but nobody really knows for certain about that one. Well, I don't know. Maybe some people do. I'm not convinced of it yet. But other symptoms can be fever, night sweats, skin sensitivity like a sunburn feeling, swelling or joint pain, heart palpitations, irregularities of the gastrointestinal tract, stomach cramps, that kind of thing. When it comes to viruses, bacteria, fungus, and parasites, most of the symptoms mirror each other a lot. So if you're going to go only by symptoms, you're not really going to know what on this list to do. I mean, how many of these different things I've talked about have already had some kind of gastrointestinal disturbance or some type of head issue or whatever? Unless you're using some type of a blood test or a stool test or a muscle test, you're not going to know which is the best one for the client. Another issue that comes up is sometimes we have more than one product for the same thing. Look at all those things for Mycoplasma goodies. You're going to have some system that's going to tell you which is the best one for that. Let's go on a little bit further and we'll go to yeast fungus. Aspergillus, that grows in wheat and grain. YFBD comes up a lot. That's blastomycosis. It affects the skin a lot. You get it through inhalation or a break in the skin. YFCI is San Fernando Valley fever, which is now found worldwide. It's the third most common cause of head issues in the United States today. The other two I told you was toxoplasmosis, which is the PSTG. There's also a tendency to have thrush when you have the valley fever goodie. So you can use a regular anti-thrush blend for that. Let's go on a little bit further. We're almost done here. Let's go to oncogenes. We believe that these oncogenes are a fragment of a virus that attaches to a gene, and we think they alter the genetic messages of the body, and it gets transferred down through some variations of the generations. They're smaller than a virus, and they're almost like a retrovirus, we think. They can cause leukemias, sarcomas, lymphomas, those type of stuff. We never tell a client that they have cancer. I guess it's because we think, our belief is that everybody's got cancer. You've got it all the time. And it's either going to kick in or kick out of your body depending on what kind of stress levels you have, that type of stuff. We don't tell them that they have cancer. What we usually say that is when this comes up in the body, that it's a very serious need for that body to do some serious genetic cleansing. And these formulas were designed to work with the RNA and the DNA for fixing the genetic code in the body and do that deep cleansing at that level. Let's see what I can tell you here. Pork eaters seem to test for the oncogene formulas a lot also. So people that have had pork or eat pork sometimes test for oncogenes really quick. When a client is still sick after many programs, it's usually an oncogene that's still making them sick. If you've tried everything and nothing has worked on a person, that's where you start to suspect oncogenes. If they're still sick after taking an oncogene, it's usually another one within that set that they need to take. When an oncogene comes up in a person's test, you also want to go back and retest for bacterial infections, because the bacterial infections cause a lot of problems with the oncogenes, and they kind of go hand in hand together. An oncogene can be the cause of any problem, including a simple headache. It can actually be an oncogene problem. So don't think that, you know, it has to be all serious and it's all just a cancer thing. It can be the cause of any particular type of problem. Oncogene X and oncogene Y have been discovered by psychiatrists to do some interesting things when taken in conjunction with each other. Oncogene X on one day, oncogene Y on the other. We found out that when people have a distorted view of love, when they've been dumped in a relationship or something like that, or they can't move on with their life, if you take oncogene X one day, oncogene Y the next, they get a clearer outlook of what they want to do and where they want to be with their lives. We've also had people that have taken the oncogene formulas and have told us that when they are on chemotherapy systemically, is that the right word for that? That they are a lot less sick when they're taking the oncogene formula. I mean, if that's all we can offer them, I mean, why not? That's a good thing. I think that your amino acids and enzymes and vitamins and all that stuff and minerals get depleted when you go through high stress levels of chemo and all these other goodies. So when you're taking these formulas that have the tinctures in them like that with those high doses, these are mega doses. These are not, remember, less is more. That's not our philosophy. This is more blasting people with stronger things. That's the complaint out there, like I said, is that there isn't companies enough that have a product that is strong enough to get and take care of what's out there. Okay, let's go on to the last part. We're almost done. This is the DNA life force viruses. These deal with mental and emotional blocks. So it says shoal number 1, shoal number 4, and shoal number 6. Let me tell you what these things do first. They adjust your viewpoint in life. They're almost like a mental miasm, just something that's caught in an entity within your family. They allow for a freer flow of energy mentally, emotionally, and spiritually. They lift your heart, increase awareness, alertness, sound judgment, strength, and substance to the body. Now, the shoal number 1 is when people are blocked at the very beginning stages of stuff. Have you ever had clients that no matter what you do, nothing really works for them? They can't get off a square one, they can't pass go and collect $200. A month ago, a woman comes and she's got agoraphobia. That's like where you stay inside the house a lot. She can't even talk on the telephone because it represents an outside contact. It's devastated her family because she's been this way for 5 years and nothing has worked. She won't even go to the doctor out of the house. The muscle testers had to go to her. She wouldn't even talk to them on the phone. You had to talk to her relative, and the relative told her what you were saying. So she went inside, did the muscle test, and took the shoal number 1. And within 7 days, she was walking her dog out in the front of the property. Within 7 days. And that's like after being, you know, a lot of different stuff with psychiatrists and things like that didn't work. So that's how shoal number 1 works. The next one is shoal number 4, and that's when people were blocked in the middle of something. They have catastrophic expectations, high anxiety, those types of things. If you give them shoal number 4, then that usually alleviates a lot of problems for them so they can carry on with their program. Shoal number 6 is at the end for follow-through. If shoal number 6 ever comes up for somebody, it's usually a person that's got too many things going on, too many irons in the fire. They do not want to take care of business around them. They want to run away and take a vacation somewhere, that type of stuff. That's what shoal number 6 does. And when that comes up in the muscle test, you will usually be accused of being psychic or whatever, because these are 100% accurate when you get to this stage of it. When you get to that stage, it's just that people are just so amazed that you can read them well. These are also for people that no matter what they've done, they can go only so far in their healing, and that last stage they cannot go on to the next stage of their healing. It's a block at the very end. So that's what they take as the shoal number 6. With that formula, the 2 tinctures and the dry blend, there is what we call the life force viruses right underneath. And we usually find that there's a couple of organs that are blocked in the body that are holding a mentality. This is where it gets kind of fun, where you do the emotional with the physiological part to it. It says LV neuro is lack of concentration. Life virus glandular is a simulation and a harmony. LV pneumo is grief or lung issues. Maybe they're grieving over a lost job or relationship or whatever. LV hepato is resentment with the past. Goes to the liver. LV spleno, anytime there's something wrong with a person's spleen, it's usually something to do with fear of the future. So let's say a person comes up with shoal number 6, too many things going on, they want to run away and take a vacation, whatever, and then they test also for the LV spleno. There's something in the future that they have to do that they're trying to avoid, and they're not going to do it, and they're going to get sick over it so they don't have to do it. That's how that works. LV Reno is the most fun because anytime somebody comes up with LV Reno, this is dealing with sexuality. Oftentimes, I would say about 70% of the time, people who have LV Reno are in an affair and they want to keep it hidden, or they're in an affair and they want out, or they're not in an affair and they want in. I mean, I'm really shocked. Yeah, I'm really shocked at this stuff. It works so well when you start testing along those areas. So when your kidneys blow out, it's some type of decision that you need to make about a sexual relationship. Yeah, really. Okay, there's a second list we're not going to go over, which is the tissue support herbs. You can look at that at your own leisure. If these things are as bad as I said they are and that they're really out there, you're going to have to do some type of tissue support along with it to support the lung, liver, kidney, spleen type of goodies. Any questions so far?
You missed joy.
Joy, yeah, there's one in there for joy, for people that don't have a lot of joy. I want to look at something I had here for just a moment. I think that's about it. Any other questions? When we do these herbs, there's a lot of spiritual, magical things that go along with them. I don't know if there's that interesting to a group like this, but we actually use Tibetan singing bowls to mix the herbs in them. And before we put an herb in the bowl, we will strike the bowl on the side and set up a vibrational force in the bowl first. And then we will add the herbs one by one into a radiating star pattern, sort of like Tibetan sand painting. Yes?
What do you do for a child
A child for bedwetting. The dosage is going to be very different. Bedwetting could be anything from a virus to a parasite. I would just muscle test them first to find out what it is. There's a bladder tea. We make an actual, like a tea, a rough cut of herbs to put together, and then they could probably take a tea with something like that to help heal the bladder. Bladder issues are tricky. There's a lot of different things going on there. The child dosage would be 1 pill for every 50 pounds of body weight. People that have tubes in their mouth and can't swallow, we usually put it over the liver or the spleen. You open up the capsules and make a paste, squirt the tincture on top of it, add a little water, cover it with saran wrap, and let it go through the spleen or liver, and that helps them that way. My mother's 90 years old, and she takes 4 sets a day sometimes. And she's doing pretty good. A couple of months ago, we had somebody with Alzheimer's. I saw some books in the other room about Alzheimer's, and one of the things that we found that helps tremendously with that is YF alba candida. And my next door neighbor was diagnosed with early Alzheimer's, didn't know the day, the week, the month, the year, nothing. And so she took this formula, and maybe about 12 days later, she knows the day, the week, the year, everything, and went back to the doctor, and they said, oh, well, we misdiagnosed her. She didn't have Alzheimer's after all. You know what? The truth is that she probably didn't. She probably had the candida that was affecting the brain. It was YF alba candida under yeast fungus. Another question?
Have you studied toxicity of metals?
Yeah, we have one called Toxo PB. It is the strongest formula we have, and it makes people really sick. So unless you haven't had luck with other things, you know, this one will do it, but it pulls it out real heavy. It's nickel, lead, cadmium, and mercury, and gold, and then there's a separate formula for aluminum. You have to remember these things are all handmade, and the turnaround rate is about, if you call in an order, it takes us about maybe 3 days to make it up, and then another couple of days to ship it out to you. We're not designed to do like drop shipping type of thing where you call in an order and then we send it to like 50 different people. We can't do that because that would just take too much time. We sell only to practitioners and doctors. These are called prescription herbals. They are too strong. I mean, I have pharmacies that keep this stuff in the back with the prescription herbals, you know, because they like it, they know what it does, and some people are asking for alternatives. I think that what's going to happen is that the insurance companies are actually validating a lot of herbal research right now because they would rather pay $1.98 for saw palmetto for somebody's prostate than to pay $700 to have it removed. So indirectly, the insurance companies are validating a lot of stuff that we're using because they don't want to pay a lot of these big operational costs. All right, we're summing up. One question in the back.
Yes. How, your test kit, how many?
There's 214 vials in the test kit.
How much is that?
And I believe the test kit is 250 for the test kit. And I've got like a couple of them made up already. Not with me, but I mean, back at the monastery, yes.
Do you have any information on the hand process?
Yes, if you want to call me, I can send you some stuff on that.
What was the question?
Question?
Where's your facility located?
It's located in Granada Hills, which is close to Magic Mountain, about 30 minutes north of Hollywood. Granada Hills, Northridge area. And we're on a ley line there. Ley lines are very interesting because they're geologic energies that are in the earth. And so the company has always been on a spiritual street or a spiritual line. At the end of our street is Mission San Fernando. So we've always had our company where we needed to have it because of the healing energies. Those are important to us also. That's it? Yeah.
Well, thank you for a great
Thank you very much. I appreciate it. Thank you very much. Thank you.
Packing's been very well.
Okay. All right.
I had a patient start taking this. The woman that came from Toronto to see me with Lyme's was seizing. I put her on the formula, and within half an hour, she had Herxheimer's reaction. Quite dramatic. So these things work from my limited experience, so I encourage you to try this. We're going to end the morning session. We'll start the afternoon session about 5 minutes to 2. We'll have a few minutes from the dams group. There's a little key that was found in the back yesterday. Looks like it's part of a chastity belt or something like that. So, I'm a Catholic. Michael, you forgot some juice. So have a good lunch. You're on your own, and we'll see you about 5 minutes to 2.
good question. I think that it has to be a concern.
Well, if I can pick up on the same thing, one of the reasons we're concerned in A201 to spell out clearly the relative responsibilities of the owner and the architect on one side and the subsystem designer on the other is exactly that issue. And what it comes down to in, again, going to EJ's field of curtain walls, if the curtain wall fails at the top corner of the building because we said that it should be designed for 40 pounds a square foot and it actually suffered a load of 60 pounds a square foot, that's really a problem for us and the owner to be concerned about and not for the contractor to be concerned about. It's not intended to be a finger-pointing exercise in which we then go to Harmon and say, you should have known that a 40-story building in downtown Los Angeles is probably going to have higher wind loads than we have called for. That's our responsibility to sort out. I'm sure you can find some set of circumstances in which you could raise an argument of that kind, but clearly the intention in A201 is to say, if it's determining the design criteria and the performance specifications, as long as the contractor meets those stated requirements, the rest of it is the architect and the owner to deal with.
Well, ladies and gentlemen, we've run out of time for this session, and it's time for lunch. And if you wander out through these doors, there will be people to greet us and that will escort us to a tent where we're going to have lunch outdoors.
Hi, Harry.